Hi and welcome. You're listening to the Fix My Brain podcast with your host, Dr. Todd Turnbull. In this podcast series, we will be reviewing the fixmybrain.org website. Thank you for joining us today. Welcome to today's broadcast. Today we're going to be talking about dizziness and balance issues. And if we open the website to fixmybrain.org, the Test My Brain page is what usually opens up. And we can scroll down to the part where it talks about balance, dizziness, and vertigo issues. On balance and dizziness and vertigo, there are some descriptors here I want to go through with you. And typically, dizziness is related to lightheadedness, whereas vertigo usually is the spinning, the world is spinning or you're spinning. Also included in this is the BPPV and the POTS issues. BPPV is the benign paroxysmal positional vertigo. This is the spinning that results when there's changes in head position, for example, turning over in bed. And then the POTS is the postural orthostatic tachycardia syndrome. This is where you have an increased heart rate and dizziness and fatigue. And this is usually when the person goes from sitting to standing or from laying to sitting. It's usually that upright position that triggers that increased heart rate and the dizziness. I want you to also know that nausea is highly associated with dizziness issues, and that again can be anywhere from mild to moderate to severe. What causes dizziness issues are things like anxiety, dehydration, fluid in the ear, inflammation in the inner ear, as well as inflammation in the brain and brainstem. Medications can cause dizziness. Low blood pressure can result in dizziness and vertigo. And head injuries. And with head injuries, there's a couple different things we want to look at here. There's the otoliths, or the crystals in the inner ear get dislodged, and that can result in triggering your vertigo issues. And also from a head injury, the joint and muscle tension resulting in increased tension and pressure in the joints and in the brain stem and brain and spinal cord. And so all those issues are things that can cause dizziness, balance, vertigo problems. So in rating dizziness problems, we're going to use a 0 to 10 scale. 0, there are no symptoms, and a 10, it's the most severe issues. You can't get out of bed. You can't do anything. Your head is just spinning. And so if we go to the red arrow here, rate your dizziness symptoms, we click on that, we can come through. And this is a quick daily monitor that you can use. Does dizziness increase with head or body movements? And again, that can be anywhere from a mild to moderate to severe. You can click on there. You can grab the slider and slide it to where it feels appropriate. Is dizziness affecting your social life? Is it affecting your physical mobility? Does dizziness restrict your travels, right? And then we go down, does dizziness interfere with job or household responsibilities, washing dishes, cooking, cleaning, etc.? And then does dizziness affect your emotional state? And for some people, that can be quite severe. And also, really important is, does dizziness affect your relationships? And again, this is something we can look at rating here. In the email box, you can put in any email address you want. It can be yours, it can be your healthcare provider or a family member. And then you hit the submit box and that will send off to them. In the dizziness handicap inventory, I've got a link here to a questionnaire to help identify difficulties that you may be experiencing due to dizziness or unsteadiness problems. Click that link, we open up to this 25 questionnaire, and there's a grading system with this. And this is going to go through some of the similar questions we had before. Again, you may want to fill this out for your healthcare provider. So go through these questions real quick, and your answers are going to be a yes, a sometimes, or a no. Does looking up increase your problem? Because of your problem, do you feel frustrated? Because of your dizziness, do you restrict your travel for business or recreation? Does walking down the aisle of a supermarket increase your problems? For some people, this can be quite severe. They can't even go to the supermarket. The colors, the bright lights, the shiny floors, all of these things can distract. Typically, if you've got a head injury, your eyes are probably going to be a little more sensitive to light. Question 5, because your problem, do you have difficulty getting into or out of bed? Again, the dizziness might be in there. You might have been diagnosed with POTS, the postural orthostatic tachycardia syndrome, where when you get up, either quickly or slowly, you get dizzy, lightheaded. Typically, people that are have been in bed for a while due to other injuries and issues, they get up, and again, that blood pressure change results in dizziness. Does your problem significantly restrict your participation in social activities such as going out to dinner, going to movies, dancing, or going to parties? Because of your problem, do you have difficulty reading? And again, not only because the dizziness and the focus of your eyes, again, there might be challenges with your eyes resulting from a head injury. Does performing more ambitious activities such as sports, dancing, household chores like sweeping or putting away dishes increase your problems? Because of your dizziness, are you afraid to leave your home without having somebody accompany you? And if this is the case, please let people know, hey, I'm going to go out for a walk, but I'm not real comfortable. If they're not willing to go with you, at least have them check up on you and make sure that you return. And the challenge with being dizzy and being unsteady is that you can run into walls, counters, etc., other objects, and even worse, you can trip and fall, and then you're going to re-injure your head potentially and make your issue even worse. So we want to definitely be guarded with what we're doing there. Because of your dizziness problem, have you been embarrassed in front of others? Do people think you're drunk or that you've been taking medications or drugs? That's what a big concern for being embarrassed. Do quick movements of your head increase your problems? Again, this is the turning over in bed or the quick look like driving in traffic and you turn to look and all of a sudden you're dizzy. And that again, that might be related to those otoliths or those crystals in your inner ear. Because of your dizziness, do you avoid heights? Does turning over in bed increase your problem? And, some of these questions on this questionnaire are repeat questions, and, it's evaluating overall the impact of dizziness on your life. Because of your problem, is it difficulty for you to do strenuous homework or yard work? Again, that might be a yes, a no, or just sometimes. Because of your dizziness, are you afraid people may think you are intoxicated? Because of your problem, is it difficulty for you to go for a walk by yourself? Does walking down a sidewalk increase your problem? Similar to the grocery store, the sidewalk might be issues for people with concentration and focus in their balance. Because of your problem, is it difficulty for you to concentrate? Question 19, because of your dizziness problem, is it difficult for you to walk around your house in the dark? And if that's the case, please have some low lights on. Maybe add a little plug-in light in your hallway or something. Again, we want to avoid additional falls. Because of your dizziness, are you afraid to stay home alone? Because of your dizziness, do you feel handicapped? And for some people, that can be quite severe. Has the problem placed stress on your relationships with members of your family and or friends? And because of your problem, are you depressed? Again, if your activities are limited, you're used to participating in activities, and now you can't do that because you're dizzy, there can be some depression associated with that. Question 24, does your problem interfere with your job or household responsibilities? And number 25, does bending over increase your problem? Again, that's going to increase pressure in your blood pressure in your head, which may result in the sense of dizziness. And it might also be the otoliths in your ears being moved, which might add to the dizziness. So then we can go down and we can do some scoring here. And what we want to look at each item here, we're looking at A no is a zero, a sometimes is a two, and a yes is four. And then so you can add those scores up, and then you can see whether your dizziness is mild, moderate, or severe. And what I want you to know about these questions that we've asked on this questionnaire is that they're designed to incorporate functional, physical, and emotional impacts on your disability. Again, it's a great form to use for your healthcare providers, gives them something statistically significant to add to your record. In future video, we will address how to resolve these issues with your dizziness. But I will tell you real quick, if you just go to the Make My Brain Better page, there are some treatment protocols we recommend for dealing with your dizziness and vertigo issues. Thank you for joining us today and have an awesome day.